What we were trying to do is we were trying to further help personalized medicine for women with breast cancer, and specifically we were trying to find a tool in order to help predict whether one patient would respond to one drug versus, well, not really versus another, but whether they would be good candidates for a particular drug. So what we did in the lab was try to understand a pathway and a process, and we identified through that lab work a few candidates that might be able to serve as markers in the clinic. A sort of a flag that we can use, and in our case we'd be looking at a protein flag, which would be, we would test on patient samples which are readily available, and test whether or not a patient is a good candidate for, in this case, taxane therapy. It is a chemotherapy, so there are toxic side effects, so we would like to minimize those side effects and only identify patients that we know that will do well, and there's currently no marker for taxane therapy in the clinic.
Dr. Goping's work is critically important because we consider breast cancer to be a very complex puzzle, and it's made up of all different pieces, and we're only going to come to a resolution on breast cancer by researchers like Dr. Goping and everyone else that we fund and invest in, unlocking those pieces one by one.
The research was a small portion that helped us identify these candidates, and now we have to see, are they truly useful clinical markers? So we need to expand the study, and we do this with a number of people that we collaborate with, and we look at thousands of patient samples now and see whether or not it will be a useful tool for physicians to use for treatment decisions.